Tens of thousands of South Africans are dying annually from diabetes. Diabetes is now the leading natural cause of death according to StatsSA, accounting for more than 27,000 lives annually. Well, to unpack this further, we're joined by the Minister of Health, Dr. Aaron Motsoaledi. Minister, good evening. Thank you so much for your time. Really do appreciate it. Does this surprise you at all that diabetes is a leading killer in South Africa?
Good evening, Oliver. Good evening to the viewers and listeners. No, it's not surprising because we are going fast through what is called an epidemiological transition. It is happening all over the world, but it's also happening very fast in South Africa. What is the epidemiological transition? It means we are switching over from diseases that are caused by infections. That means infectious diseases, which we call communicable diseases like TB, HIV, AIDS, malaria, yellow fever, etc., cholera. We are switching fast from those to what are now called non-communicable diseases or diseases of lifestyle, which are usually, we identify 5 of them, and diabetes is #1 on their list. So it's not surprising. It's what the world is going through. Only that in South Africa, because it's a complete turn around from what we've been doing, it becomes surprising.
Let me contextualize that because I do think it's important. The shift from communicable diseases as being leading killers to non-communicable diseases as being leading killers, is that as a result of the improvements of medical sciences pertaining to communicable diseases? That is to say that we're getting better at treating those, preventing those, and making sure that they are as less deadly as possible? Or is it because we're seeing an increase in non-communicable diseases? That is to say, that's just getting worse.
Well, it's 2 factors. The first one, you are okay. Remember, we've been working very hard to eliminate diabetes, TB. There are even vaccines. We have just launched lenacapavir. We have worked very, very hard over the ages. And the United Nations has even passed a sustainable development goals, which say by 2030, we must have gotten rid of some of these things like TB, HIV, AIDS, malaria, etc. So definitely it's advancement in science. But on the other hand, we have changed our lifestyle. The diseases of lifestyle are increasing. It's not because the others are going down. The others are going down, yes, but these ones are increasing on their own. And because they are not caused by a single factor, like I know the bacteria that causes TB, I know the virus that causes HIV, or the virus that causes Ebola, or even COVID-19, we knew those viruses. But with non-communicable disease, you can't point and say this one has been caused by this one has been caused by that. We actually talk of risk factors. And to make it easier, we identify 5 non-communicable diseases and 5 risk factors for all of them. #1, non-communicable disease is diabetes. Then we've got cancer. We've got hypertension and heart diseases, including strokes and kidney problems and all that. We've got chronic respiratory diseases. Then we've got mental health. The risk factors, which can affect any one of them. In other words, you don't say this one is a risk factor for that, this one is a risk factor for that. The risk factors are risk factors for all of them. #1, on top of everything else, is cigarette smoking. #2 is excessive use of alcohol. #3 is wrong diet, wrong and poor diet, like eating a lot of sugar, a lot of fat, a lot of salt. And #4 is sedentary lifestyle, where people don't exercise at all. Especially among black people, they used to exercise without intending to do so, like walking long distances to a school or a hospital or a clinic. Now, today, we are living a fast life with Ubers and all that. We are always in a lift or a taxi and all that. Things that were not there in the past, but replacing them, we have not gone on to replace, to get into the gyms because they are expensive. So that's why these diseases are now coming to us. When they were not there among black people, Oliver, when I was at medical school, we hardly ever found a black person with diabetes or high blood pressure. We hardly ever found them. There were very few in between. They were not factors, but now they are big factors. Of course, the last risk factor are environmental conditions under which people are living now.
Yeah, Minister, you problematized food, or at least the things that we consume. That is to say, as to mention some of them, a lot of processed foods, processed carbs, processed sugar. You mentioned salt as a high intake of salt as a risk factor here from a lifestyle perspective. What's government doing from a policy perspective to ensure that there's some level of intervention to make sure that people are less exposed to these sorts of things? Because oftentimes, particularly for consumers that have very little options to themselves, that is to say those who do not have a lot of disposable income, they are left stranded with unhealthy food options.
Yeah, definitely. That's a very good question, Oliver. Because let's take diabetes, for instance. There are 4 ways to treat diabetes. The other one is just healthy diet, good lifestyle. That's number 1. Without taking any medication, you can stop diabetes from happening, or you can put it under control. But when that fails, for whatever reason, you then start popping pills. When the pills do not put the diabetes under control, we start poking you with injections. Sometimes 3 times a day. You can imagine for the rest of your life being injected 3 times a day. When all those fail, we start replacing organs. We start doing kidney transplant. We start doing cataract removals. We start amputating. So as you can see, the best of them all is this prevention. And that's where the state must come in. And indeed, we have come in. Let me start with salt. In 2016, when we learned, Oliver, that South Africans are eating more than 4 times the amount of salt that the body needs. It's not that salt is dangerous or useless. I mean, it's useless in the body. It's not. But when you eat 4 times more than what your body needs, there are going to be problems. And what will be the problem? High blood pressure, kidney failure, and we start doing dialysis and all that. Now, in order to stop that, we identified 6 types of foodstuffs which are commonly consumed every day, which have got a lot of salt. Number 1 is bread. Bread is eaten every day, sometimes 3 times a day, yes. And it had a lot of salt, which was not necessary, and people did not know about that. The second one is brining chicken. These frozen chicken are brined, and what is brine? It's salt water. They are injected with salt water to preserve them. But at home, you are still going to add salt, and some even add the 3rd time on the table. Then there are soups. Then there are snacks. Then there are, cereals, etc., etc.
Yeah.
All those processed meats, yes, they've got a lot of salt. We sat with industry in 2016 and said, people, there is trouble here. There is trouble here. We have to do something about it. Can we regulate you? Then there's, can you regulate yourself? They said, no, regulate us. We agreed with them that will decrease the amount of salt in 3 tranches. 2016, then we waited, we did it again, and we did it after 3 years, and after another 3 years. People don't know about it, but they are no longer fed a lot of salt. Then sugar. With sugar, you remember, we came with sugar tax. Many people thought we were just raising money. We were not raising money. We wanted to discourage them from consuming a lot of sugar. Then we made laws against trans fatty acids. At the moment, we are busy with labeling of food. We are busy with regulations to push industry to label food so that people must know what they are eating. And I'm happy to announce that in September last year, the United Nations gave us a prize for the work we have done in reducing the amount of salt people are eating in South Africa.
Yeah, Minister, we're going to have to do that. Thank you so much for outlining some of those interactions and interventions. Really do appreciate it. That's the Minister of Health, Dr. Aaron Motsoaledi.